Hi, my name is Dr. Sergio Glait. I'm one of the hand and upper extremity specialists here at the Orthopedic Center, South Florida. And I'm here to talk to you today about rotator cuff tears and what exactly are they. So a rotator cuff tear involves a tear of the tendons surrounding the shoulder joint. And this is a model of the shoulder joint. We have 4 tendons that go from the front all the way to the back: the subscapularis, supraspinatus, infraspinatus, and teres minor. And those tendons essentially allow for the shoulder joint to move normally in all different planes of motion. And rotator cuff tears are basically injuries to those tendons, either a partial tear or a full thickness tear, that mostly affects people in their 50s and 60s, although it can be much younger or much older. It's important to recognize if you have a rotator cuff tear, because in that event, you should seek out medical attention and have it evaluated. Not all rotator cuff tears require any type of surgery. Sometimes they can be treated conservatively with therapy, injections, and medication. So a common way of getting a rotator cuff tear is a traumatic injury where someone falls down. And if you get a traumatic rotator cuff tear, that definitely requires immediate medical attention because diagnosing it and treating it quickly allows for better outcomes rather than ignoring it. Some signs and symptoms of having a rotator cuff tear can include pain with overhead lifting. Very commonly, my patients complain of pain at night on the shoulder and they toss and turn after an injury, achiness and pain in general when lifting the arm overhead. Some rotator cuff tears are partial tears where it's not a full thickness rupture. So let me explain the difference. If this is a model and the tendon is attached here to the bone, a full thickness tear means that the tendon completely tore off the bone and is free floating in a way. And so those tears, when caused by a trauma, require repair because they don't fix themselves. However, sometimes based on the mechanics of our shoulder and how it moves around, we can get partial tears of the rotator cuff, which can cause symptoms of pain and discomfort affecting our activities of daily living and our quality of life. And this usually occurs based on how the shoulder moves and how the tendons on the humeral head collide with other bones around the shoulder joint, and due to repetitive motion over the years can cause slight tearing of the rotator cuff. And that could be treated conservatively with injections and therapy to decrease the inflammation, allowing the tendon to heal and to also decrease the pain. So now that you're more educated on rotator cuff tendon tears, next time you have a new shoulder pain and you can't figure out where it's coming from, don't forget to call your orthopedic doctor and make an appointment to have it evaluated sooner rather than later, because if a tear goes unnoticed for a very long period of time and it's a full thickness tear where the tendon completely comes off the bone, it can retract, meaning the tendon could move away much further from the bone, and over the years it can become stuck in scar tissue and it may not be fixable down the line, leading to other problems. And so that's one of the important reasons why you need to seek out medical attention if you think you may have injured your shoulder.